Hello and welcome to Ask the Doc podcast. My name is Dr. Christian Salazar and I'm co-host of this program here at UCI Mind. If you're new to this channel and this podcast, UCI Mind is part of a national network of Alzheimer's disease research centers designated by the National Institutes of Health. And today I have the honor of interviewing Dr. Karen Lincoln, Professor of Environmental and Occupational Health and Director of the Center for Environmental Health Disparities Research in the Program of Public Health here at UCI Mind. Dr. Lincoln received her BA in sociology and a minor in African American studies from UC Berkeley. She then received her master's and PhD degrees in social work and sociology from the University of Michigan. Now a distinguished professor at UC Irvine, Dr. Lincoln is a trailblazer in health disparities research. She's dedicated her career to unraveling the social determinants of health disparities, especially among Black Americans and the elderly. As the founder of Advocates for African American Elders, she's a beacon for aging-related issues here in Southern California. Dr. Lincoln's accolades are numerous. She's a fellow of the Gerontological Society of America, a Hartford faculty scholar, an Encore Public Voices Fellow, and a Next Avenue influencer in aging. She was ranked third among the most influential African-American social work scholars in the US and was spotlighted among the top 2% of scientists worldwide by Elsevier and Stanford University in 2022. Welcome, Dr. Lincoln.
Thank you.
It is truly a pleasure and an honor to have you with me on the program today.
Thank you, Dr. Salazar. Thank you for that wonderful introduction.
And welcome to our viewers. If you are attending live on Facebook or YouTube, you can participate in the question and answer Q&A with Dr. Lincoln by typing in your questions in the comment box, and I'll get to your questions as soon as I see them pop up. Okay, Dr. Lincoln, I'd like to begin by asking about your research. Your research and advocacy are deeply rooted in the Black American experience. How has your personal background and upbringing influenced your professional journey, especially in addressing health disparities?
Yeah, so by way of background, I'm from California. I'm a native. I was born in Sacramento, actually. My parents migrated from the South. My mom from Louisiana, my dad from Texas, and my grandparents settled in California. And we come from very modest beginnings, and just growing up in 5 generations of African Americans from the southern states, we noticed obviously there were a lot of disparities. We didn't really sort of think about it that way. We had a pretty healthy childhood in reference to what was going on in our communities. But as I got older, we did start to see more death. My grandfather died of a massive heart attack when he was in his 70s. My father was diagnosed with diabetes and lost his eyesight in his 40s. My mom has dementia. And there were just a host of other comorbidities that were going on in our communities, and we still continued to thrive. And so my interest in health primarily comes from my own lived experiences in the communities where I grew up, both in rural areas and in metropolitan areas and housing projects, and sort of looking around and seeing what was happening at the social and environmental levels and trying to really understand how do Black people thrive, sort of in spite of some of our circumstances, and what are some of the things that we might be able to do to, increase the lifespan. And then, of course, after graduating from UC Berkeley, I went to the University of Michigan, and I was trained at the Program for Research on Black Americans by James Jackson and my mentors. And within that space, we only solely focused on the lived experiences and health of Black Americans. And so through that training over the course of 7 years, I learned a lot more about what was happening with Black people nationwide and also around the world, and saw the importance of working in interdisciplinary spaces around Black wellness. And so that was really the foundation of my work.
Interesting. And you've highlighted the impact of negative interactions on the mental health of African American and Caribbean Black adults. Can you shed some light on how these negative interactions might manifest in daily life and how they might contribute to health disparities?
Sure. So by negative interactions, we're talking about the kinds of negative experiences and encounters that we have within our social network. And so my dissertation really focused on trying to understand the role of social relationships, which are really important for many Black communities, but also understanding the negative side of that. And so trying to disentangle the way that we measure social relationships by taking out the negative and really looking at them separately. And so by focusing on both positive and negative interactions, my work has shown that even though negative interactions like criticism, demands, sort of being, having these sort of negative exchanges within your family networks and your friendship networks don't happen as often as the positive kinds of relationships, but they have much more robust and negative effects on our health. And so what we see consistently across the literature, not just mine, but the sort of body of literature that looks at social relationships, the sort of the dual nature, we find that these negative encounters and experiences within our social support network contribute to poor mental health, poor physical health, higher levels of distress. And there are also links to cardiovascular health and obesity and other kinds of health outcomes that we don't really think about being so associated with our social relationships, but they in fact are.
Yeah, and thinking a little bit more about how this relationship between mental health and physical health, your research actually touches upon both the psychosocial and biological mechanisms linking the social determinants of health, social determinants to health and well-being
Mm-hmm.
of individuals. Now, could you provide maybe for us a practical example of how these factors might work together or interact to influence outcomes for African Americans?
Sure. I think the most practical example is the recent work. We just completed a study in August, and we were trying to understand accelerated aging. That's one of my other areas of research because studies have shown that Black Americans age faster than whites at the biological level. And that sort of exposes us to a whole host of chronic health conditions that would typically happen at older ages. Our body starts to wear down. And so I wanted to see if racial discrimination was associated with this accelerated aging process. And so I worked with some colleagues at UCLA to examine how racial discrimination is associated with gene expression, this sort of molecular stress that happens. So we looked at 50 different genes that are markers of inflammation and sort of aging at the biological level, sort of stress responses. And we found that Black Americans who experience more frequent encounters of everyday discrimination actually age faster. And so we're finding this link between what's happening in our social environment and toxic stressors that are contributing to an accelerated aging process among Black Americans.
And may that explain some of the disparities that we see in the African American population, like in many different outcomes, stroke, Alzheimer's disease, related dementias?
Yes. And that's exactly why I wanted to do this study. And not just to say, yes, racial discrimination or these experiences are impacting health and certainly can help us understand some of the health disparities with respect to some of these chronic health conditions that are more prevalent in Black Americans. But also, I also wanted to find out, is there something we can do about it? And so within this same study, I looked at two different disruptive factors, right? Things that can disrupt that relationship. And one of them was a psychological variable, cultural mistrust. I wanted to see if that might help us understand something that might prevent or slow down the effects of discrimination on this accelerated aging process, and also social relationships. So we looked at friendship relationships and family relationships, and we saw that both of these variables can actually help to protect Black Americans from experiencing this accelerated aging process, even when you're experiencing high levels of discrimination.
That is very interesting. And it highlights a lot of work that you're doing and others are doing to help ameliorate and address these disparities. Now, I want to ask specifically about your organization that you helped found, and you're the director for, the Advocates for African American Elders. What are some of the most pressing challenges faced by what you call seasoned citizens in Southern California? What does that term mean, and how does your organization tackle some of these challenges?
Yeah, so seasoned citizens, we refer to our older adult population in different ways. Seniors, elders, seasoned citizens, it really depends. And I think it also speaks to your question in that the pressing issues and the challenges there's a variety of them, right? It really depends. Because we're talking about, this is Black Americans in general, a very heterogeneous population. And so there's many different challenges depending on one's location, depending on one's experience, depending on one's age and where you live and what your lived experiences are. And so we have identified Alzheimer's disease and brain health as a challenge and a priority, but also housing and food insecurity and other types of stressors that are happening in the social environment. Incarceration, unhoused people. And so I think the types of challenges, they really do span the gamut of the types of issues that are unfortunately prevalent among Black American populations. COVID, I think we sort of coalesced around issues concerning stress and death and, exposure to this virus that was really prevalent in our communities. But even at that same time, while people were really concerned about COVID, being exposed, being vaccinated, and unfortunately, dying as a result of COVID, there were still these other issues that people were primarily concerned about, right? Less concerned about COVID, but also concerned about some of these other issues. And so I think it's really important for us to think about, Black Americans as a very heterogeneous population, people who are born here in this country, who migrate to this country where English is not their first language, right? Regional effects. Again, I talked about my family being from the southern states, very different culture. Texas is very different from Louisiana, is very different from California. But one of the things that I think is very prevalent and common that many Black Americans experience are the results of racial discrimination, right? Whether it's the sort of day-to-day exposure or the persistent effects of, Black laws, Black codes, Jim Crow, redlining, the kinds of policies that have sort of created communities that are, disadvantaged, as a result of legislation. And then they result in a whole host of other social determinants of health that lead to some of the disparities that we're seeing in our communities.
That's very interesting. And you briefly touched upon some policies. Can you pinpoint one policy or initiative that you believe might make the most significant difference in kind of bridging the gap in health disparities in this particular population?
It's so difficult because there are so many policies that have created this landscape that's very hard to disentangle and work backwards with respect to health equity. I think, for example, the Affordable Care Act and the various attempts over many, 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 many years to achieve health equity is a wonderful conclusion, I think, to some extent, of many, many decades of advocates trying to ensure that we all have the access to quality care. And so I think the primary initiative that I see in my mind are efforts to work both upstream and downstream. Upstream meaning sort of the policy level changes that need to happen to ensure that we all have access to housing, right? So when you think about redlining and the fact that many Black Americans could not get a mortgage, right? Or were exposed to very high interest rates, or were forced to live in certain areas. How do we dismantle that, right? How do we achieve equity in that regard? So even with respect to housing. What are some of the laws and policies that will allow Black Americans and others who were discriminated against with respect to housing to achieve housing equity, right? So it's really difficult to disentangle those things. And so I think any initiative that focuses on policies to ensure that low-income populations, disadvantaged populations that have been discriminated against historically, have access to those health restorative resources and health promoting resources are initiatives that I can get behind. And unfortunately, one of the primary affirmative action laws that have sort of at least helped ensure equal access to education, for example, has been dismantled by the Supreme Court. And I should say that race can no longer be used with respect to college admissions, but it still can be used in the military, right? And so how we pick and choose when we use race and why it's important and when it's not important is a big policy issue, but it's also an ideological issue that's rooted in systemic racism. And I think these are the kinds of policies that we need to reveal, we need to uncover, we need to critically analyze in order for us to begin to respond to them.
Yes, that's very important. And you touch on different aspects of policies that you like to see changed. Are there any emerging trends or areas of concern that you believe need more attention, I guess, in the coming years as we think about which policies might need to change?
Well, I think, I'm moving into this environmental health space, and I'm also very much aware that our younger population is really concerned about climate change and the world that they're going to live in, that they're going to inherit, right, as a result of some of what we're doing as adults and some of what our predecessors have done to the earth. And so I think some of the pressing issues that are not new issues are around our environmental health. And I think that what's really important about the transition that I've made to UCI and working in environmental health and health disparities is to really raise the awareness around the issue of climate change and climate justice, environmental health and environmental justice, and how many of us who are living in communities, particularly Black Americans, are surrounded by a built environment that is really harmful to our health, but may or may not be aware, right, that one, these built environmental factors and these sort of the pollution and the wildfires and the water quality is damaging our health. And so I really want to raise awareness around environmental health issues in our communities. And so it's not an emerging issue or a trend. I think the issue is the lack of knowledge and awareness and engagement in the conversation around climate justice that many Black Americans should be engaged in. And I should say that Dr. Robert Bullard is known as the father of environmental justice, and he's African American, right? This is something that goes back to the 70s with respect to environmental justice. And so we're just going back to our roots in terms of the issues that are really important to us. And many Black people have been advocating for environmental justice. I just think we need to really highlight that so that we can start to grow and train advocates so that we can have just clean water and clean air.
This is great. And, having well-trained staff and having interdisciplinary training really matters to tackle these very important issues. And you certainly have this unique interdisciplinary training. How do you see the intersections between social work, sociology, psychology, in contributing sort of a holistic solution to tackle these important issues?
Yeah, it's a good question. It's very hard for any one discipline to tackle any of these issues. We really need team science. We need people who are able to understand policy analysis and advocacy at the policy level, as well as those who are working sort of downstream, right? The clinicians and social workers. And interestingly enough, I do want to make my pitch for social workers because I am half, social worker, half sociologist. And that social worker is one of those fields. Social work is a field where we're focused on macro, meso, and micro, right? So we're looking at policy. We're looking at those macro factors that help us better understand not just how to help families and individuals, but how to advocate at the policy level. And we're also looking at systems and communities and organizations as well as individuals. And so I think by having social work, sort of, if you think about that as the hub, how psychology fits in there, right? Psychology is primarily looking at individuals, right? And then of course, sociology is looking more at the macro level, at the societal level. And so I think, these are fields that can work together with respect to addressing social determinants that are very complex and that have very different domains at different levels, as well as, policy and health behaviors in individuals. And so when you think about the social ecological model that's sort of addressing health at many different levels, this is where this team science and this interdisciplinary network of investigators, whether they're from the community or the academic or industry, can come together to solve the problems.
And as you mentioned, team science is really the way to move forward in tackling these very important issues. And as a professor here, how do you instill the importance of understanding and addressing health disparities and tackling these very important problems in your students, especially in such a broad field like public health and social work?
Yeah, I'm teaching my first class at UCI. And it was last taught in 2019. And so it's been a few years since it was taught. And so I took on this class called Health Status and Care Disparities, and sort of reimagined it. And so the textbook that I've required is The Political Determinants of Health. And it allows our public health students, both at the master's level and the PhD level, to engage with those sort of macro level factors to better understand human behavior. Because oftentimes within public health and other fields, we're focused on human behavior and changing the way that humans engage and understand and act upon health messages, right? But we also have to understand the broader environment, and that includes the social environment and the political environment. And so I told my students, I'm training advocates. I want you to be able to, yes, sort of meet our, population, our residents where they are with respect to their humanness and their lived experience, but also understand that when we're asking people to change their behavior, we have to understand how those behaviors are influenced by not just where they live, but the policies that are sort of happening at the historical level and at the contemporary level. And so, it's a wonderful course to teach because we're able to talk about the full range of factors that impact human health, as well as our agency as individuals. And so I have experts coming in from the academy, from different fields within the academy, but also community experts, which are very, very important, who are doing this work at the community level. And so the integration of all of this different levels of expertise at these different contextual levels create a really rich environment for students to understand sort of the full scope to understand health disparities.
And this highlights the team science that's involved in tackling these issues, which is great. With that, Dr. Lincoln, let me thank you so much for your time. It's been truly a pleasure and an honor to have you with us today. And let me close by asking, what comes next for you? What's the next big project or area of research you're diving into? And are there new horizons or challenges you're looking forward to addressing?
Yeah, it's again, coming to UCI and to public health and environmental health in particular has just, my mind is swirling around with all of the wonderful things that we'll be able to do to expand our work. And so including aspects of the environment is really important, right? So I just finished a sleep study focused on, the relationship between sleep and cognitive impairment among African Americans. And of course, you cannot ignore the impact of the sort of larger environmental factors on sleep quality, right? So to be able to include factors that take into account pollution and noise and crime and sort of where people are living and how that's impacting their sleep is really important. So that's one of the new things that I would like to explore in my work to, again, sort of take into account all of the factors that help us understand human behavior, because I think that's going to help us lead to better interventions when we have more information about what the barriers and facilitators are to good health, and in this case, good brain health.
We look forward to your continued contributions to the literature and your help in addressing these very important issues. Thank you so much, Dr. Lincoln.
Thank you. It was a pleasure.
And thanks to all of you who attended live today. You can access this and past Ask the Doc episodes, podcasts, and more on our website at mind.uci.edu/mindcast. And next week, we'll be chatting with Dr. Michael Leone here from UCI. But in the meantime, to learn more about research at UCI Mind, you can visit our website or consider signing up for the UCI Consent to Contact Registry at c2c.uci.edu to learn more about research studies that might be right for you. Please take care, and we'll see you next week for Ask the Doc at UCI Mindcast. Thank you so much.